And now for a very personal perspective on all of this, joining me is Staci White. She serves as the board secretary of an organization called the International Pemphigus and Pemphigoid Foundation. Staci was diagnosed with pemphigus vulgaris, also known as PV, back in 2011. About a decade ago, it's a rare chronic autoimmune disorder that causes antibodies to attack the skin. After what was a long journey battling PV, Staci will now celebrate 6 years in remission this summer, and so for that, we congratulate you, Staci. Thank you for being with us today.
Thank you. Thank you so much for having me and for having this event.
So let me begin with your story. Walk us through the journey that you undertook before your disease was diagnosed.
So in 2010, the fall of 2010, I started experiencing symptoms. So I went to my gynecologist actually because I thought I was experiencing lesions in my vaginal area. And she tested me twice for an STD, only to discover that the test came back negative twice. And even though that was the case, I was still given a script for a cream and the lesions eventually went away. I spent the next several months just dealing with a variety of different issues that seemed unrelated on the surface. A sinus infection that wouldn't go away, losing my voice, things like that. And by the spring of 2011, I started experiencing lesions in different parts of my body. And I went through a battery of blood and urine tests, went to multiple dermatologists, went to my primary care physician, all of those, any provider I could find. Meanwhile, the disease was essentially exploding in my body. Finally, I was diagnosed with shingles and given treatment for that. And during that time of my treatment, I went from having a few lesions to lesions covering about 85% of my body. In the midst of that, the dermatologist that had diagnosed me with shingles then called me, actually had his nurse call me and tell me that they made a mistake and that I probably had something else. They just weren't sure what it was, but it was probably an autoimmune disorder. And they then referred me to NYU on Memorial Day weekend, on the Friday of Memorial Day weekend to be specific, and said that I needed to get in touch with someone there who could help me figure it out. From there, I spent several days in a pretty deep depression, a couple of days trying to figure out if I could play doctor myself on the internet. And then finally landed in the ER of Hackensack University Medical Center in New Jersey with, as I said, lesions over about 85% of my body, unable to stand erect, and was finally diagnosed while I was in the emergency room.
Had you ever heard of this condition? Was there any connection to any family members that might have suffered from a similar disease?
No, I had no idea what it was. I could barely pronounce it, to be quite honest. And when I landed in the ER, I was struck by the fact that the attending at the time, who I will forever be grateful for, said that she thought she had seen it in a textbook in medical school. And that then triggered a course of events or a chain reaction in terms of actually getting me a diagnosis.
So where does pemphigus come from? Where does the term come from? What's its etymology?
So essentially, it is my immune system just not acting the way it's supposed to in the simplest terms. And it affects the dermis layer of the skin. And essentially, it is your skin attacking itself. So it's as if when people think of getting a scab, that's the body's natural way of protecting itself. And my body was essentially attacking my healthy tissue as if it was unhealthy. And I was just having repeat scabbing blisters that would just pop, and then the process would just start over and over and over again.
So for those who have suffered shingles, this sounds like it's, for lack of a better term, shingles on steroids. It sounds awfully painful.
It's extremely painful, and certainly my case was one of the extremes of it. Shingles tends to be in certain areas of the body in specific places. This was, as I had mentioned, over most of my body. So wherever you could imagine it could be, I had lesions in my hands, on my feet, on my legs, in my head. It was pretty much everywhere where there was skin, there was some type of lesion on my body.
And we should point out that you have been involved in your adult career over the last 20, 25 years with educational healthcare nonprofits. So you are familiar with the healthcare industry. But just on a personal level, so whether you want to take a walk, take a shower, just the normal day-to-day activities with this condition, how did you deal with it?
It was challenging. It was challenging because it was, like you said, just doing the basic things that a human being wants to do in an independent adult. I was 38 when I was diagnosed. So, and I lived on my own and was ferociously independent. I couldn't open a bottle with my own hand. I had friends who would come over just to open a Gatorade bottle. I had to accept the fact that I needed people to help me take care of myself. I received a similar level of care as a burn victim. So I had to have nursing support in the initial stages of it. I had friends and family members who did rotations. My body was wrapped in gauze in different areas to keep me safe. So it was humbling in that experience, but as someone who works in healthcare, particularly in the moment that we've been in for the past 2 years, the level of empathy and connection I have with patients and that I'm able to communicate to my teams as important was invaluable from that experience.
But Staci White, your story is also an inspiration, and as we said at the top of our introduction, you are now in remission in 6 years. What was the treatment?
So I was on a medication cocktail of prednisone, of Celsep or mycophenolate, and a variety of different drugs to offset the side effects. So prednisone is, many people are familiar with, it's a steroid medication. And Celsep is typically used for patients who have had an organ transplant. It's an anti-rejection drug at the end of the day. Both of them suppress the immune system. So in many ways, my physicians were kind of tricking my immune system to acting the way that it needed to.
And having gone through this now, and I hate to ask the question, but how do you make sure it doesn't come back again? What are your biggest concerns?
What I've recognized in the process is that there's nothing I can do short of moments like this with you and the Hill and the advocacy work that I do with the International Pemphigus and Pemphigoid Foundation working toward a cure and awareness. That's what I can do in that space. In terms of making sure it doesn't come back again, I don't have control over that other than advocating for a cure. So I think it's one of the messages I want to make sure people understand, particularly those in the position of making decisions about policy, about rare diseases or for rare diseases. When you are in remission and not cured, it is always a part of your being. So you're acutely aware of the possibility of it coming back. So it never really leaves your spirit. So that does weigh on you, but I choose to approach it from a perspective of wellness. So my general attitude is that I believe if I'm in the healthiest state I can be in, I'm in the best position to fight this thing. And so far, so good. But I also recognize it could come back, but I don't live my life waiting for it to come back. I live my life trying to take the lessons that it gave me. And it gave me numerous unexpected and beautiful gifts that I would not have asked for, but that I am deeply, deeply grateful for.
Two final points. We've used the term diagnostic odyssey for those who need to figure out what's causing this illness. And you indicated that you were getting different diagnoses from different doctors. So what did you learn about the medical profession as you went from physician to physician to say, hey, what's wrong with me?
What I learned is that there is a need for a multidisciplinary approach to diseases, period. I liked very much what the doctor who was right before me said, in that, consider rare disease as an option. Don't just assume it's what you have already known. I've learned that physicians and medical providers need to maintain that same curiosity that made them an interest and excitement that made them get into the medical field in the first place. And if you see something you don't know, ask some more questions and listen. Please, if you do not hear me say anything else, please listen to patients. We know when something is wrong. And even if we don't have the words, trust that we know that something isn't right with us. And ask the question and ask your colleagues, dig a little deeper and do it with compassion.
Your body is telling you something, which is really my final question. Very simple one. How are you doing today?
I am great today. I am grateful. I often tell people I often talk about the gift that pemphigus vulgaris gave me, and it sounds terribly counterintuitive. But I learned a lot about who I am as a person during a really difficult time. I also became the person I was supposed to be. I think that I needed to sit down. For those who know me, that was not my MO. That's not who I was. I was always busy. I was always moving. I didn't appreciate the fact that speed and movement forward requires relaxation. And I also birthed a great deal of creativity. So I am doing extraordinarily well. I'm grateful that um, my journey has put me in a position where I can now be a voice for the 30 million, or one of the voices for the 30 million of us living with rare disease.
The brightest rainbow after the darkest storm. Staci, thank you very much for sharing your story with us. We wish you the very, very best.
Thank you so much.